Hello friends, so this is the second part of my video. फर्स्ट पार्ट को आप लोग ने बहुत प्यार दिया, so let's go. Which electrolyte imbalance causes Schwartz and Trousseau's signs? The right answer is option B. Next one, the antidote for warfarin toxicity is. The right answer is option A, vitamin K. Next one, which ABG finding indicates respiratory acidosis? The right answer is option C, low pH and high pH CO2. Next one, the most common cause of hospital acute pneumonia is. The right answer is option B, gram-negative bacilli. Next one, which cranial nerve controls lateral eye movement? The right answer is option C, abducens. Next one, the normal adult urine output should be at least. The right answer is option C, 30 ml per hour. Next question, which condition is characterized by moon face and buffalo hump? The right answer is option B, Cushing syndrome. Next one, which blood group is called the universal donor? The right answer is option A, O negative. Next one, which vaccine prevents cervical cancer? The right answer is option C, HPV vaccine. Next one, which artery is commonly used to assess pulse during CPR? The right answer is option C, carotid pulse. Next one, the earliest manifestation of hypovolemic shock is. The right answer is option B, tachycardia. Next one, which electrolyte is mainly responsible for neuromuscular excitability? The right answer is option B, calcium. Next one, the normal INR range in a healthy adult is. The right answer is option A, 0.8 to 1.2. Next one, which insulin can be administered intravenously? The right answer is option A, regular insulin. Next question, which ECG wave represents ventricular depolarization? The right answer is option B, QRS complex. Next one, the first vaccine given after birth under UIP is. The right answer is option A, BCG vaccine. Next one, which cranial nerve is tested by the Snellen chart? The right answer is option C, optic nerve. Next one, a patient with severe burns is at highest risk for. The right answer is option B, hypovolemic shock. Next one, which heart valve lies between the left atrium and left ventricle? The right answer is option C, mitral valve. Next one, the hallmark symptom of diabetes insipidus is. The right answer is option C, polyuria. Next one, which electrolyte imbalance commonly causes muscle weakness and cardiac arrhythmias? The right answer is option B, hypokalemia. Next one, which drug is the antidote for acetaminophen or paracetamol poisoning? The right answer is option C, N-acetylcysteine. Next one, which condition is associated with a butterfly rash? Right answer is option C, SLE or systemic lupus erythematosus. Next one, which part of the nephron is primarily responsible for water reabsorption? The right answer is option C, PCT or proximal convoluted tubule. Next one, the most common cause of maternal mortality worldwide is? Right answer is option A, PPH or postpartum hemorrhage. Next one, which electrolyte abnormality is most commonly associated with flattened T waves on ECG? The right answer is option B, hypokalemia. Next question, the antidote for OPP poisoning is? The right answer is option A, atropine. Next question, which cranial nerve is responsible for the corneal reflex or sensory reflex? Right answer is option B, trigeminal nerve. Next one, the most common cause of nephrotic syndrome in children is? Right answer is option A, minimal change disease. Next question, which ECG change is seen in hypercalcemia? The right answer is option B, shortened QT interval. Next question, a patient with head injury develops unequal pupils. This suggests what? The right answer is option C, increased intracranial pressure. Next question, which vitamin deficiency causes megaloblastic anemia? The right answer is option C, folic acid. Next question, which blood component is preferred in severe anemia with active bleeding? The right answer is option A, packed RBC. Next question, which condition is characterized by rice water stool? Right answer is option C, cholera. Next question, which artery is commonly used for ABG sampling? The right answer is option B, radial artery. Next question, the most common cause of hyperthyroidism is? The right answer is option B, Graves' disease. Next question, which electrolyte is mainly regulated by aldosterone? The right answer is option B, sodium. Next question, which heart sound is associated with atrial contraction? The right answer is option D, S4. The first line drug for status epilepticus is? The right answer is option A, lorazepam. Next question, which vaccine is administered orally? The right answer is OPV, option C. A patient with SIADH typically develops? The right answer is option B, hyponatremia. Next question, which condition is characterized by strawberry tongue? The right answer is option C, scarlet fever. Next question, the most common complication of prolonged immobilization is? The right answer is option C, DVT or deep vein thrombosis. Next question, which cranial nerve is responsible for shoulder shrugging? The right answer is option C, accessory nerve. Next question, which insulin has no pronounced peak? The right answer is option D, glargine. Next question, the most common pathogen causing infective endocarditis is? The right answer is option A, Staphylococcus aureus. Next question, Which electrolyte imbalance causes muscle tetany? The right answer is option C, hypocalcemia. Next one, which position is preferred for a patient with air embolism? The right answer is option B, left lateral Trendelenburg. Next question. The most common cause of community acquired pneumonia is? The right answer is option A, Streptococcus pneumonia. Next question. Which electrolyte is most important for nerve impulse transmission? The right answer is option A, sodium.